and Dr. Smith will give a more full report on that. It impacts 2 additional counties, Benton and Greene. And as Dr. Smith has released in a news release, it does impact some of our long-term care facilities, 3 of those, which is of great concern to us. And those actions, appropriate health care actions, are being taken. But it simply shows that we have to stay on top of this, that we have to take seriously the admonition that we all have a responsibility to ourselves and to our neighbor to take proper health care precautions, social distancing, make sure that we're not a carrier of this and we're going to impact somebody else's life. In addition, I wanted to talk about our business operations. Yesterday, we set forth a number of guidelines, directives in terms of business operations. That has been incorporated in the Department of Health today, that's been released, that articulates more specificity in those. But in terms of business, we did have some restrictions on businesses that were identified in the Health Department directive, which includes restrictions in in-room dining in restaurants and bars. It included the gyms and some indoor facilities. But we also gave guidelines for normal business activity, which includes manufacturing, which includes a whole host of very essential activities that we have in Arkansas, and those are continuing. And I did ask businesses to make sure that we're screening employees, to make sure that we have social distancing in the workplace, that we have proper cleansing and work environment. These are expectations of business to be good partners, but we also want the business to continue. I've had multiple calls as to whether we're going to have further limitation on business. Well, that obviously is determined based upon the healthcare guidance and the circumstances in Arkansas, but there is no intent to further restrict or close businesses and industrial activity in Arkansas. There are many companies that are engaged in essential activities of manufacturing, even healthcare products that are essential. But we expect them to take the proper precautions, but there is no intent to have further business closings or reduction of manufacturing at the present time. I also wanted to mention Dr. Patterson yesterday talked about the partnership with UAMS and the state and our hospitals in providing PPE or personal protective equipment, which is a great need that we have in the state. Secretary Walther, through the Department of Finance, has issued an advance of $30 billion to help procure in a greater quantity at lower cost advanced materials that we need for the future. And so this is collective buying power that the state is supporting so that we can get a handle and ahead of the demand for personal protective equipment that is needed in Arkansas. I want to thank UAMS for their leadership on this, as well as the Department of Health that will help set the priorities for the release of this PPE as that comes in. It'll take some time to make that procurement, but that is in the works. The Attorney General has an important announcement that we'll make a little bit later that I'm delighted that she's joining us today, and Secretary Key will have additional comments in terms of our education and testing here in the state. I also wanted to mention, in conjunction with the activities of business, we've seen the social media post that it had the National Guard going in to help us in the call center at the Department of Health. And the National Guard was there, reduced the backlog along with the great workers at the Department of Health from over a 500 call backlog down to 10 the other day. They've done tremendous work in assisting, and I've also asked them to plan contingency for what might be needed in the future. And so if you see a National Guard person going around healthcare facility or somewhere. This is simply planning and learning appropriately. There is no further guidance to the National Guard other than preparation and the logistics support that they've given to us thus far. With that, I'll invite Dr. Nate Smith to make his report to you.
Thank you, Governor. As the Governor mentioned, we have had an increase in cases from 62 to 96 today. That is, again, our largest single one-day increase in cases. More of these reports are coming from commercial labs being reported to us. That's a good sign. It means our testing capacity as a state is really increasing quite a bit. I wanted to give just a little bit of detail on those numbers of those 96. 8 are children, adults who are 65 and older, and then 62 are adults aged 19 to 64. There's a fairly even split, slightly more women than men. That's likely to even out over time. And then in terms of race, 71% white, 17% black, and then the other are others or race unknown. In terms of the big news, it really is these 3 long-term care facilities where we have identified cases. These are our most vulnerable population where we're most concerned. What we are doing in each of those cases is working very closely with the staff and management of the facilities to test all of the residents as well as all the staff. We will segregate those residents who test positive from those who test negative, and we will also exclude any staff members who test hard to try and limit transmission in that setting and to support any residents or staff or visitors who fall ill. And that's the end of my report for today. Oh, one other thing. Yes, I'm sorry. With the commercial lab testing, there's a bit of confusion out there, I think, amongst the providers. They can order those and send them to commercial labs without permission from the Department of Health. If we have a case that needs expedited resulting through the RTORI, that's where they need to call and get permission to send that in to us. But private providers, clinicians can just go ahead and order those, send those off to the commercial test without permission from the Department of Health.
Let's go to education next. Secretary Key, would you give us a report?
Thank you, Governor. Earlier today, the Trump administration and Secretary DeVos announced that they would be establishing a waiver process for states to pursue, and if they could not test under the annual assessment requirement under the Education Act, Federal Education Act, we are going to cancel under that waiver, cancel the ACT Aspire administration for this spring and seek that waiver. And it is a waiver which, when we submit it, check the boxes and make the assurances that they will approve it. That will also impact some of the other assessments that are in conjunction with the ACT Aspire, such as our kindergarten through 2nd grade assessments and the dynamic learning map assessment, which is for our students with who have the most learning difficulties. So that's a much smaller segment of students. But with that, that will create some comfort and peace of mind with our educators so that later in the school year, they are not going to have to worry about preparing for the exam and getting the kids ready for the exam. This will give them an opportunity to focus purely on the students and maintaining the education process through the rest of the school year.
Thank you, Secretary Key. And the Attorney General has been a good partner, and I wanted to introduce her for an announcement that will go to the small businesses in Arkansas and relief and help that they're looking for.
Thank you, Governor. Honored to be here with you all today, and thank this group for all the work that they have done. And we want, at the Attorney General's office, we were working every day on a number of issues regarding consumers, but one need that we have seen, and we applaud the governor's efforts, and we want to add on to that, and that's taking care of our in Arkansas. And while we have seen Arkansas's largest company, Walmart, make an incredible announcement in their commitment to $550 million in bonuses to current employees and quickly providing 150,000 new jobs. We love Walmart for doing that, and we appreciate them. But unfortunately, not every business in Arkansas is similarly situated. And we have a lot of families who are hurting, a lot of businesses who are not able to take care of their workers. And so today I am pleased to announce that I am committing $3 million from the Consumer Education and Enforcement Fund to go to the Arkansas Economic Development Commission's Quick Action Loan Program. This is $3 million in addition to the $4 million previously committed by Governor Hutchinson, for a total of $7 million, and that is going to help out our small businesses and families across the state to get them the money they need now to take care of their employees and their employees to take care of their families. I would also like to give a quick update on price gouging and the efforts that my office has made with regard to bad actors in the state. We have received approximately 185 complaints on price gouging. Fortunately, not all of those have been active complaints. Some of them have been fake individuals who have posted something on Facebook as a joke. Please do not post on Facebook or social media if you are joking about selling an item at an exponential rate, because you will get a call or an email from my office. That being said, we have about 24 active investigations ongoing on price gouging. Likewise, we have put out an alert on fake websites. There are literally thousands of fake coronavirus and COVID-19 websites. These are phishing scams where people are attempting to get your personal information, your Social Security number. Please use our Department of Health website and the CDC website for information about COVID-19. Likewise, we have been made aware of instances where at least one individual has approached an elder person's home claiming to be from the CDC or another health provider, and stating that they would perform a test and be charging that individual money. Not only does this put that elder person at health risk, it also threatens their financial resources and the opportunity to steal money and their identity. I know that the gentleman standing up here with me can assure you that the Department of Health and the CDC is not making house calls. And so if someone comes to your door claiming to be from the CDC or the Department of Health or any health facility at this time, send them packing and call law enforcement. And then my last thing I would like to mention today is, in light of this having been Sunshine Week, and the Freedom of Information Act in Arkansas has one of the strongest Freedom of Information Acts in the entire country, we want to ask Arkansans to be patient with us, because we are putting so many of our state resources toward working on addressing this health crisis in our state and in our country. So be patient if you ask for a FOIA request. If it is something that can wait a couple of weeks, please give it a couple of weeks. We have state employees working round the clock, but we want to put these resources behind addressing this crisis. So please know that we're going to get you answers, but understand that it may take a little bit longer because those resources are being used to address this crisis. Thank you so much.
Thank you, General. That's good news for Arkansas businesses that are being challenged right now to have another avenue of opportunity for bridge loans to get through and hopefully to keep employees in place. I will add that I had a call with our federal delegation today. Our congressman, our senator, engaged on this, and I asked help today from them to make sure that we had our SBA disaster declaration for small businesses in Arkansas, and we had put in, and I had signed off on the disaster. It had not been granted yet. They came to our aid, and I'm pleased to announce today that the SBA has indicated approval of Arkansas being a small business disaster area in which we can receive now that are important for our businesses in Arkansas. With that, Dr. Cam Patterson is here, UAMS Chancellor, as well as our Surgeon General. I'm going to go ahead and go to questions now, but they'll be available if there's questions that they need to address as well. Be happy to take any questions.
Do we know which 3 long-term care facilities that this has infiltrated?
Yes, there is a news release that is on the, should be on the website, Dr. Smith, for the 3 particular nursing home facilities.
Are any of those residents hospitalized now, or what kind of condition are they?
There are 2 residents from 2 separate nursing homes who have been hospitalized.
Do you know what condition they're in?
Pardon?
Do you know what kind of condition they're in?
They were actually hospitalized for other unrelated issues, and not for respiratory issues.
So they were already hospitalized when they're...
Yes, in both cases.
How did it get in to these facilities?
In one case, this is a facility in Pine Bluff, and that patient was likely exposed to a physician who became infected from our original patient. In the other cases, we're not sure. In one of the facilities, there are some staff who have also tested positive. Now, whether the staff were first infected and then the residents later, or vice versa, we don't know. Very concerned that visitors can be a source of these infections, which is why we made the move as a state to basically not have visitors for a period of time, and that's why. And I know that's been very difficult for many families and not understanding why, but this is why. We really want to keep COVID-19 out of the long-term care facility setting because it can spread so easily, really quite devastating.
So at Briarwood, there were 13 people. How does that break down between residents and staff?
That's 9 residents in addition to the initial one, so a total of 10 residents, and then 4 staff.
Do we know how many people have some sort of underlying condition that have tested positive?
Would you repeat the question?
Yes. How many who have an underlying condition, who have tested positive? We don't have that information in a systematic way. Sometimes the information with either the test specimen or the test results from commercial labs doesn't have that level of detail.
So did you mean that there was one resident who was tested positive a long time ago, and now there's 9 new ones? Or?
Not a long time ago, but the index patient who tested positive, which is why we tested the other 9.
Do we have enough respirators and ventilators in the state? This is a question that I see other states kind of dealing with that maybe are ahead of us in the number of cases. Are we prepared for that? And is that part of the money that the governor has just freed up for personal protective? Is that something that you guys are looking for using that fund as well?
Well, the number of ventilators that we have in the state right now serves our current needs with some surge capacity, but I think every state and all states now have cases are dealing with the real possibility that there'll be a greater need than they can supply. This is, it's difficult to know what's going to happen in the future, but I think all stability.
Dr. Patterson, you want to add to that?
Sure. So this is a contingency that we're paying a lot of attention to. The good news is that we have more than enough ventilator capacity for our needs right now and our immediately anticipatable needs. The bigger question is how do we make sure that the ventilators are in the right place? And I'm really while we need to be concerned about everything, I'm less concerned about the total number of ventilators and more concerned about making sure that the ventilators are in the right place at the right time. So I think, if we become constrained, the first thing that we'll see, and probably the most important thing that will happen, is that we'll be moving assets like ventilators from places that are not experiencing a significant need to places that are. And those processes are being put in place right now.
Attorney General, you mentioned the price gouging, and I remember in the previous press conference where you were at, you said that hospital masks that were 80 cents, they were being charged $22 for. Is that still going on? Are hospitals still being price gouged?
Well, I would probably need to defer to Dr. Patterson on this, but the short answer is yes. And unfortunately, because this is, many of these suppliers are from, and vendors are worldwide, and so they are not here folks locally that we can go knock on the door and explain the law to them. We have been sending letters, we have been emailing, we have been on the phone with these vendors, but to the extent, and if it's gone beyond those initial items, I would defer to Dr. Patterson.
Sure. I have been on the phone both yesterday and today with senior leadership at hospitals across the state, and we're all experiencing the same thing. Coming out of the woodwork is the right term to say in this regard, and we're trying to figure out who are the legitimate partners and who are people who are opportunists. The good news is we're talking amongst ourselves, so that nobody's really being surprised by who is approaching us. And I think the most important thing is to use the power of this government and Governor Hutchinson's office to allow us to make purchases collectively, and that really cuts these shady characters out of the equation.
Thank you, and not directly related to that, but in a similar fashion in terms of the logistics and the supply chain and all of those that might be inquiring about. We've got a supply source that the state can utilize. We have agreement that there's going to be the logistics side of this emergency is going to be handled at our ADAM, Department of Emergency Management, and so they're going to be pulling that together under Director A.J. Gary. Did I say this right? A unified command. And so this will be a simpler approach to looking at procurement in a coordinated way.
Dr. Bledsoe, have you had anybody approach you about, some of the overstock that they might personally have?
Great question. I actually have. There have been people reaching out to me on social media. There have also been people who have been texting me and contacting me through friends and colleagues. And in that respect, it's been really inspiring. To the Attorney General point, I've also been receiving, unfortunately, some calls around the community that there are some bad actors in the lab space, for instance, who've been trying to upcharge nursing homes, upcharge primary care clinics, and offer them tests that are not appropriate. And I've already had a discussion with the Attorney General's office about this, and if that is going on, we need to know about it because we're committed to making sure that doesn't happen. But thank you.
Secretary Key, canceling the ACT Aspire test, what's the long-term ramification of that? And then as we extended the time off until April 17th, that's an additional 2 weeks. I know a lot of schools had prepared AMI days, teachers not being allowed into their school building to get their materials. I mean, logistically, how does that all work? So
To your first question, the long-term impact of canceling this year's ACT Aspire is significant because we're working on developing a longitudinal system for accountability. And when you take one piece or several pieces of data, which will happen now, out of that calendar, so to speak, you're going to have a significant cascading effect. So we're just now analyzing what the effect will be long term, but it's going to impact our student growth measure. It's going to calculate a number of things with respect to the accountability system. As far as the AMI, I have received feedback on both extremes. Some of the AMI packets take, 30 minutes to complete, And then I have parents emailing me saying, please give us some relief because this is so hard, which just goes to show that we do have schools that have capability of creating very meaningful education packets, educational delivery in an off-site situation. We have taken the steps to work with Arkansas PBS to develop a series of, that will right now be good for the 3 weeks that will be extended, a series of resources, shifting their programming in the mornings, beginning the Monday after spring break, to accommodate that. So we have issued I believe that went out yesterday, with more details will be coming out on Monday, but grateful for the partnership with Arkansas PBS. So the school districts that don't have the capacity to bring teachers back in to develop those lessons and get those lessons out to their students can rely on the core subjects that Arkansas PBS and the Division of Elementary and Secondary Education have developed to put in the PBS delivery platform. For the high school level, that's going to be for K-8 for Arkansas PBS. And at the high school level, we're partnering with Virtual Arkansas, which has been a great partner for a number of years, as well as Arkansas Public School Resource Center. They have resources for 9 through 12 that can be delivered in a variety of media. And that's going to start for that week after spring break, again, for those districts that don't have the capacity to generative methods of instruction.
Do the students have the equipment or broadband access in order to facilitate that?
Many do, but again, there are a number of areas in our state where those students simply do not. So we are working county by county to identify zones where students can go either with their smartphone or their device, maybe to the parking lot of the local library. They could go to the parking lot of their school, anywhere that Wi-Fi is accessible. So we're working on developing the resources. And then we would just ask that many of our local providers of broadband to work with their local school districts to create opportunities for students to either get hotspots or to expand where students may not have the broadband capacity in their home now. But it's messy, and it's going to be for some time, but just want everybody to be assured that we are working with districts all over the state to make sure their students have what they need to be able to continue to get an education that's as good as possible given these extreme circumstances.
So is the lack of testing, is that going to affect funding in potentially next year?
No, sir.
Secretary Key, of course, pointed out how challenged that is for Arkansas in terms of the waiver for testing, but we are in the same position as just about every state in the country. And so it's not going to set Arkansas apart. It's just that all of education across the country is challenged this year. And I applaud Secretary Key for looking for innovative ways to make sure that we're continuing education even under these circumstances. We'll have time for one more question if there is.
The procurement,
Yes.
where's that money coming from?
That's coming, we'll get the exact name of the account for you. I think it's a revenue stabilization fund that we're making that available. We procure that advanced by the state, then hospitals will be able to add to that procurement and pay that money back.
$3 million, that's from lawsuit settlement proceeds?
It is, yes. So the $3 million is from settlement monies, and so it's not direct taxpayer money. That's from settlements that we've received, and so this is going to hopefully be a benefit to all Arkansans. Right. Thanks, Mike.
Thank you very much.
We just listened into the governor's press conference on coronavirus, wanting to talk about a few main points that he mentioned. 96 new cases today, making this the largest single day increase in coronavirus cases we've seen in the state. 8 of those cases involved children. Also, a couple new counties impacted, including Benton and Greene counties, and 3 long-term care facilities have been impacted. There were 13 positive cases from patients in a single Little Rock nursing home. So that is why they are limiting interaction from guests in these nursing homes because they're very concerned about the possible spread continuing for those in our vulnerable community. We also had Secretary Key joining us talking about education, mentioning that they are canceling the ACT Aspire test and seeking a waiver from the federal government, and that will likely impact additional assessments as well. And the Attorney General wanted to speak about small businesses, efforts that they have there. They mentioned that not every business can take care of their workers right now, so she is committing $3 million from the Quick Action Loan Program, making a total of $7 million total dollars to help small businesses during this time, continuing some of those bridge loan programs. Also, the Small Business Association has said that Arkansas is a small business disaster area, and that could provide additional help. Of course, you can go to thv11.com for all the latest information that we have on the coronavirus, and we will provide you with additional details as they continue coming in. Thanks for joining us.